Great, thank you very much for that introduction, and I'm very happy to be here. As someone who grew up as a teenage girl in the early 90s outside of Boston, I was happy to be called the new kid on the block, so we had a Beach Boys reference earlier. Okay, let me make sure I have this right. So, thanks for having me. I am new to this conference. Those of you who were here last year may have heard from my colleague, Molly Brody, but just in case anyone is not familiar with KFF, we are a nonprofit, nonpartisan research and information organization. Despite our name, we are not affiliated with Kaiser Permanente, and we're not a foundation in the sense that we don't give out grants, but we run our own programs, which include policy analysis, journalism, and polling. And I work on the public opinion and survey research team, and our aim there is really to provide objective, unbiased information about the public's views and experiences on health policy issues, so that information can be used by journalists and policymakers to really help inform health policy debates. And we really see our polling as a counterweight to a lot of the money that is used in polling by political campaigns or corporations that are looking to craft messages or sell their products. A lot of that survey research never sees the light of day in the public. We make all of our survey research available so that it can be informative in those debates. So I looked at some of the agendas from the past conferences and who usually filled this spot on the panel, and I think what I'm going to do today is a little bit different. In the past, you've heard from people representing employers or the insurance industry, providing a more business-focused forecast, but today I'm going to talk to you about the public's perspective. So I'm going to show you findings from some various different surveys. I don't want to get deep into the weeds in our survey methodology, but I'll just make the point that all of our surveys are conducted using probability-based sampling methods. We do either random digit dialing telephone surveys or probability-recruited web panel surveys. And we work very hard and spend lots of money to make sure our surveys are representative of the public, and we make all of that information available. So yes, my thunder did get stolen a little bit here with some data showing that healthcare is an important issue to the public. So if we, I like to say that the last 10 years have definitely been a good time to be a healthcare pollster. The public and journalists really care about our issue. Certainly during the time the ACA was being debated and implemented, there was a lot of demand for how does the public feel about this policy, and that really hasn't abated over time. You see here, in 2018, in the national exit poll, the midterm election, healthcare was the #1 issue. Moving into the current election cycle, our own survey in December 2019 found it, again, the top issue that people want to hear presidential candidates talk about. And then in the primaries on the Democratic side that we've had so far in both New Hampshire and Iowa, healthcare was named as the top issue in the exit polls. Again, Bill showed some other data. It's nice to see different surveys confirming the same facts. So when people say healthcare is important to them, what do they really mean? And what they're really talking about is the cost of healthcare to individuals. So here we asked a question about the top priorities for Congress when it comes to healthcare. And you can see I've shaded in gray 3 of those top 4 priorities relate to out-of-pocket costs for people. So lowering prescription drug costs, lowering what people pay for healthcare in general, and protecting people with insurance from surprise medical bills. So a lot of the political and policy debates have focused around more detailed things like repealing and replacing the ACA or creating a Medicare for all system, but those are more minor concerns for the public. What people are saying when they say healthcare is important is that they think it's too expensive and they want some relief from those high costs. Here we can also look at which costs people are concerned about, and you can see that really what we're talking about is what individuals are paying for healthcare. We often say healthcare is a pocketbook issue, and so you see at the top of the list of what people are concerned about is increases in what individuals pay for healthcare. Some of those issues that economists are more focused on, increases in what the nation as a whole spends and increases in spending on Medicare and Medicaid, those are also important to a large number of people in the public, but really what's top of mind is the cost to individuals. And you can see how this plays out in people's level of economic anxiety as well. So here we ask people how worried they are about being able to afford a variety of different healthcare costs as well as other types of expenses. And there's a couple things to notice. First, in light blue, those are the healthcare items, including unexpected medical bills, insurance deductibles, prescription drugs, and insurance premiums. And you can see in general that a lot of those items are something that causes worry for more people than other basic needs like affording transportation or housing. And second, I think it's also worth noting what's at the top of the list of those healthcare worries. So unexpected bills, sometimes called surprise medical bills, are at the top, and fully 2/3 of people say that they're worried about being able to afford those. And that's followed by people saying they're worried about affording their insurance deductible. And I'll dig more into deductibles in a minute, but surprise billing has been a hot topic in the news and on Capitol Hill, and so I just want to drill down a little bit on that. So in our surveys, one of the things we really try to do is ask about people's experiences in addition to their opinions. And so here we asked about their experiences with unexpected medical bills. So a lot of the discussion on Capitol Hill and among other groups, when they're talking about surprise bills, they're talking about a very specific thing, which is when a patient either knowingly or unknowingly sees an out-of-network provider and gets a surprise bill. But from the public's perspective, there's sort of an even broader issue with being able to understand or anticipate what their insurance company might pay when they receive care. So we first start with this broader question: was there any time in the past 12 months when you received care and your health plan didn't cover the bill at all or paid less than you expected? And you can see that's a fairly common experience for people. About 4 in 10 people say this has happened to them. When we follow up with that and we say, did your insurance company say that was because the provider was out of network? About half of that group, or about 2 in 10, say that was the reason behind the bill. So it's a substantial share that's experiencing this type of problem and looking for some sort of relief. I want to move on and talk about what's going on in the employer insurance market. And I'm not personally an expert in employer plan benefit design or decision making, but my organization, KFF, has been doing an annual survey of employers for many years about their health plan offerings. And so I want to show you some trends from those surveys, and then I'll get into the experiences of people in these plans. So one thing the KFF employer survey has been tracking over time is the average premium for covered workers and what share of that premium the employer pays versus the employee. And this chart is showing you the average premium for family coverage in employer health plans. And you can see the average total premium almost quadrupled between 1999 and 2019, from about $5,800 to almost $21,000 a year. Employers have absorbed most of the increase in terms of sheer dollar amounts, so they've increased their average contribution from about $4,000 to more than $14,000. But still, workers are seeing almost a 4-fold increase in what's coming out of their paychecks over that time, from about $1,500 in 1999 to $6,000 in 2015. At the same time that those premiums have been increasing, deductibles have been increasing as well. So you see 2 lines here. The top is the average deductible among workers who face a deductible for single coverage, and the bottom line is the average including all workers. So people who have a $0 deductible would be counted as 0 in that bottom line. But both of these show the same trend. There's been a steady increase over the last 13 years in the share that employees are required to pay out of their own pockets before their plans will start paying for any of their care. And these numbers, this is another way to look at it. They become really striking if you look at how these increases compare with workers' earnings over time. So just looking back over the past 10 years, if you look at the light blue line, you see workers' earnings have increased 26%, just outpacing inflation. At the same time, premiums for families have increased 54%. That's the orange line. But really, what's really striking is that increase in deductibles, 162% increase over 10 years. So remember earlier when I showed you that deductibles are one of the things that are really on people's minds, this kind of shows you why that's the case. So those are the trends from the employer side, but what about employees? So at the time that all these deductible increases were happening, so much of the public debate around healthcare was focused on the ACA. And when we talked about private insurance, it was really about a much smaller share of the insurance market, the individual market, and the exchanges. And I think some of the coverage of these increasing deductibles got lost in that debate. Most people do still get coverage through an employer. And so in 2018, we decided to do a survey to drill down on what these changes in employer coverage were meaning for individuals and their families. So we conducted this survey in partnership with the LA Times. We worked with DC-based reporter Noam Levy, who I'm sure many of you are familiar with his work, and a lot of his reporting was focused on the impacts of families. You can see an example of one of those stories here. For this survey, we interviewed 1,400 non-elderly adults with employer-sponsored insurance, and having this large sample size really allowed us to look at the experiences of people at different deductible levels, people with higher and lower incomes, people with chronic conditions, and things like that. So one of the findings from the survey that was most striking to me is something that I think points to a really seismic shift in how people with employer coverage think about their plans. And this change has happened over about the past decade and a half. So we went back to a survey that we did in 2003 where we asked people with employer coverage to choose the most important feature to them in a health plan. And they could choose things related to costs like low premiums, low deductibles, low copays, or they could choose things related to coverage, like the range of benefits covered or their choice of providers. So in 2003, you can see it was about 2 to 1. 60% chose coverage-related factors as the most important, and 33% chose cost-related factors. But in the recent survey, those numbers flipped. So 59% said that these cost-related factors were most important. 26% said that it was coverage-related factors. So you really see the effect that that shifting cost burden onto employees has had on people's attitudes over time. Compared to 15 years ago, people are less focused on what their plans cover and which doctors they can see, and they're more focused on their premiums and out-of-pocket spending. So this shows you kind of one of the reasons people are now so focused on cost. You know, when we think about an employer-sponsored insurance, we often think this is the gold standard for coverage in the US, but we found that it really still leaves many people vulnerable to healthcare affordability challenges. So we found that overall about 4 in 10 people in employer plans had faced some kind of healthcare affordability challenge, either problems paying medical bills, difficulty affording their deductibles, surprise bills, prescription drug copays, doctor visit copays, or their monthly premium. When we asked those people who reported some affordability challenge to say what was the biggest problem for them and their family, we see something similar to what we saw in that worries question. What do people worry about with deductibles and unexpected medical bills at the top? But you'll see those top 2 items are flipped. It's actually medical bills you face before meeting your deductible. That was the ranked number 1 as the biggest problem facing people, and unexpected medical bills was second on that list. This kind of makes sense. Unexpected medical bills being something you can't plan for, it's more likely a source of worry and anxiety, but it's really those deductibles that people are facing every day that is the biggest challenge for most people. Another thing to note here is that health insurance premiums represent a much smaller portion of the affordability problems that people report. So despite those large increases in premiums over time, people are less likely to perceive that as a problem. It's something they can plan for. It's something that that comes out of their paycheck every month. So since the rise in deductibles was a big impetus for doing this survey, we asked people in the survey to tell us what the deductible in their plan is. And we defined higher deductibles as those with a deductible of at least $1,500 for an individual or $3,000 for a family. And we further broke out a group that we called the highest deductible group that was at least $3,000 for an individual or $5,000 for a family. You can see the relative size of these groups here. So about 4 in 10 fall at least into that higher group, and about half of that, so 21%, fall into the highest deductible category. So going back to that 4 in 10 who face some type of affordability problem, we see significant variation for people in different subgroups. You can see that those deductibles do matter. So about half of those in the highest deductible category report some affordability problem, compared to just a quarter of those with no deductible. Not surprisingly, people's income is also really important. You can see those in households with annual incomes less than $40,000. Almost 2/3 of them had some challenge, compared to just about 1/3 of those in higher income families. And finally, those who say someone covered by their plan has a chronic condition. So these are folks who are likely to be regular users of the healthcare system. They're almost twice as likely as people in families without someone with a chronic condition to report a challenge with healthcare affordability. So one thing we can really do with these surveys, especially when we conduct them in partnership with a media organization like the LA Times, is to really put a human face on what these challenges mean for families and to hear the stories behind the numbers. And one thing that we found in the survey is that 17% of people with employer plans said they had to make what they felt was a difficult sacrifice in the past year to pay healthcare and insurance costs. And we asked people to describe what that sacrifice was, and some of these stories are really heartbreaking. People describe things like skipping meals, skimping on follow-up care, going into debt, working extra hours, even going through periods of homelessness. Now, I do want to point out the quotes I've picked out here, I picked out for a reason. They're sort of the most extreme. This is a very small share of the overall group. But the reason I like to show these is because these are the sort of sacrifices that you might expect among people who are uninsured or people who are very low income. They're not the type of stories that we typically associate with people with employer-sponsored insurance. And so I think it's important to point out that there are people out there who have this coverage who are still facing these hardships. So another affordability issue that's been highlighted in lots of research is the issue of people delaying or forgoing treatment or prescription drugs because of the costs. And this survey found this was a common phenomenon among those with employer coverage as well. So about half of people with employer plans say that they've skipped or postponed some type of needed care or medicine in the past year because of the cost. That could range from relying on home remedies or over-the-counter drugs instead of going to the doctor, putting off needed care, not getting a test or treatment that their doctor recommended, or cutting back or skipping prescription medicine. So not only are these high deductibles and high cost of health care affecting people's finances, in some cases they're affecting their treatment decisions as well. Here's another look at those numbers, and this is broken out by the combination of having a chronic condition and being in a high deductible plan. So this is from a column that our CEO, Drew Altman, published in Axios, and here he highlighted the shares who reported skipping or postponing care and how much higher that was for people with chronic conditions, particularly if they were in a high deductible plan. So taking that 51% I showed you on the previous slide, if we look at people in families with a chronic condition, that rises to 60%, but if you look at people with a chronic condition in those highest deductible plans, it's fully 3/4 of people reported skipping or delaying some type of care. So even among those people with employer coverage, those who are the sickest and most in need of care are the most likely to report skimping or cutting back on care or medication because of the cost. So just one more note on those people in high deductible plans. Many of you are probably familiar with the findings from Federal Reserve surveys that show the share of people who wouldn't be able to pay an unexpected bill of $400 without going into debt. One thing we're able to do in this survey is to match that up with people's deductible level to see how they might be able to handle a big medical bill. So we asked people how much they have in savings that could easily be accessed in the short term. And if we look at people in high deductible plans overall, about half of people say they have savings at least the amount of their deductible. But in those highest deductible plans, so those people in those plans with deductibles of at least $3,000 for an individual or $5,000 for a family, more than half of them say that the amount that they have in savings is less than the amount of their deductible. So if these people got hit with a large medical bill, say from a hospital stay or an ambulance ride, and had to pay their full deductible, they wouldn't have the liquid assets available to pay it. One other trend in employer coverage that I want to talk about briefly is the rise of high deductible plans paired with a health savings account. So our employer survey found that these really began to take off in popularity around 2011. And since then, just about 3 in 10 employers who offer health benefits say that they offer this type of plan. So in our survey of individuals covered by employer plans, about 18% say they were in a high deductible plan paired with a health savings account, and most of them are using their plans to pay for medical bills. So although these plans are sometimes marketed as a way for workers to invest money for the future, at this point, most workers view them as a way to pay for current bills rather than as a way to save and invest. Another idea behind these type of plans is that they'll make people wiser consumers of healthcare and encourage them to shop around for lower priced services. However, we find that the availability of information and people's ability to understand what costs their insurance might cover really can be a barrier to creating this type of savvy shopping behavior that would define these wise healthcare consumers. So, on the pie chart here, and this is consistent with lots of other survey work, about 2/3 of people say that it's difficult for them to find out how much services provided by different doctors or hospitals would cost them. And then on the right, you see about 4 in 10 people say that they've encountered difficulty understanding how much their plan will pay or what their plan will or will not cover. So this is just a cautionary note to keep in mind when thinking about plans that rely on consumers having access to and being able to understand and act on cost information in order to make them good consumers of healthcare. So I do have limited time today, and I've talked more about people's problems and concerns than what they like best about their private insurance, but I'm happy to talk about that in the questions. But I don't want to leave you with the sense that people are overwhelmingly dissatisfied with their insurance. Most people do give their insurance plans good grades. And when we ask them about various emotions they might associate with their insurance, the most common one that they identify with is grateful. So 72% of people said that they feel grateful about their insurance. 69% say they feel content. Fewer people say they feel frustrated, confused, or angry. But as we think about the trend towards high deductible plans, I think it's worth pointing out how different those responses are for people in those plans, with far fewer people saying they feel grateful or content, and more people saying they feel frustrated, confused, and angry. And without getting too far into the politics, I think that might be addressed in later sessions today, but here's a teaser of how those rising deductibles could have potential ramifications in political and policy debates. So we asked people how well the current health insurance system in the US works for people like them. And again, people in the highest deductible plans are much more likely to feel like the system doesn't work well for people like them. So that's not to say that these people would all support the same types of changes to the system, but if the share of people in these plans continues to grow, it's possible we'd see an increasing level of political dissatisfaction and desire for change. So I will leave it there. Look forward to the discussion. Thank you.